I'm here today on behalf of Graham Thornycroft, who is the overall director of the South London CLAHRC, and he sends his best wishes and he hopes to join us later, but I will just kick off. Just before I start, and I'll literally be a few minutes just introducing, before you were invited to this meeting, how many people had heard of the CLAHRC? Okay, so not too bad. The CLAHRC is not a new concept. It stands for the National Institute for Health Research, NIHR, Collaborations for Leadership in Applied Health Research and Care, the CLAHRCs. And they're very proud of this name, and it can't be changed. So you have to say it every time you talk about the CLAHRC, you have to say the whole thing. And this afternoon you have to add brackets South London. But I will talk actually just about the CLAHRCs and South London. And they're not new. They were established over 5 years ago, and there were originally 9 CLAHRCs established following Sir David Cooksey's review of the NHS and how quickly the NHS took up innovation. And the conclusion was that the NHS was very good at developing interventions, very good at primary health services research, but distributing that across so that everybody within the NHS could benefit, we weren't so good. And it was Sir John Tooke that came up with the idea that you should actually get the NHS and academics and third sector and patients and the public to work together to design the research, implement it, and then move forward. And this concept took roots, and it was so successful that in last year they invited new people to bid. And now there are 13 CLAHRCs, and specifically looking at how they can undertake health research focused on patients and public requirements, and more importantly, to translate that into routine practice across the UK. There are 13 CLAHRCs. They virtually cover the whole of England, but not completely. And we could perhaps, during discussion, come back to why that's the case. So, first and foremost, it is a research establishment, a research collaboration. But as I've mentioned, it's a distributed model. Everybody who's responsible and keen to improve patient care and indeed public health can be part of that CLAHRC, and I'll come back to that in a minute. What is interesting is that they also understand that different parts of the country have different priorities, different parts of the country have different challenges. So they went for a distributive model. So while they wanted academic excellence and put a CLAHRC around centres of excellence, they also wanted the understanding of the geography across the UK, and that's very important for implementing good practice. They also felt that the research capacity within the UK, which has always been very good, but could be even better and could actually be absolutely world class. And so one of the key functions of the CLAHRC is not only to undertake the research and to get it implemented into routine practice, it's also to encourage everybody to participate in that research and to become researchers themselves. But ultimately, of course, it's around patient and patient outcomes, and Irene will be coming back to how that's going to be played out in this CLAHRC today. And finally, but as important perhaps as all the others, is that the NHS has a role to play in the broader health and wealth of the United Kingdom, and there is an eagerness for those within the NHS, both within the research and the service world, to work within the public and the private sector to ensure that we actually get the best care for patients. This is an impossible slide to see, and I won't go through it in any detail, but it is an official CLAHRC slide, so that's why it's there. But I should just emphasize that what we have, and indeed people around this table, indeed I will argue, that the translation of research into practice is not a linear process. Innovation isn't a linear process. It's much more complex and difficult than that. But what this slide does show is that the enormous efforts that the NIHR is putting into understanding those steps. And the CLAHRC has a significant and important role down here. I think the reason why this is so important is that there is bringing together of the research worlds from the primary lab-based biomedical research right through to translation into practice. And all is seen as equally important and working together. The CLAHRCs are independent. They are 13 organizations, but together they actually encompass a vast amount of expertise, both in the delivery of service, but also in the primary research. And so there are initiatives to work together to have what is often called a college of CLAHRCs. So even though we're talking about the CLAHRC in South London, there are initiatives across the country. This is the geographic footprint of the CLAHRC, South London. It covers all those organizations within the academic and the service sector and the provision. So we're expecting and hoping that Irene can encourage all these people to work together, and this is the first meeting of the end-of-life palliative care, and it doesn't surprise me, it's the first theme meeting in South London. Irene is leading the way in this. Unusually, a lot of the CLAHRCs have just concentrated on one or two themes, but for reasons that we can discuss perhaps during the afternoon, we have 10 themes. We have long-term physical disorders, mental disorders, alcohol-related disorders, and each of these themes has a theme leader, and each of the theme leaders will be looking to work across other themes to ensure that they can deliver the best research for the investment put in. But there are also cross-cutting themes that we consider are absolutely crucial to the delivery of the CLAHRC concept, and patient and public involvement is one of those with its own head. That's a brief overview of the CLAHRCs.